All right. We earlier today did make note that it was, World Suicide Prevention Day, and that there are support networks out there. There are crisis lines for you to call. But there is also, a perspective that the strategy that's in place here in this province might not be perhaps as robust, maybe isn't as effective. Well, let's talk a little bit about this with our next guest, and we're joined on the line this afternoon by Dr. Simon Sherry. Dr. Sherry is a clinical psychologist, and he's actually calling for a revamped suicide prevention strategy in this province. Doctor, welcome back to the show, sir. How are you?
Fine, thank you. Good to talk to you today, Sheldon.
We need real actions with real funds and real deadlines. Where are the failings with our system?
Our current provincial suicide prevention strategy is just badly out of date. It's drawing on evidence that is more than 20 years old. And unfortunately, it's ignoring a lot of strong, persuasive, effective, recent high-quality evidence that could be put into action to lower our suicide rate in our province. I think I should say a bit, too, on what that suicide rate is. Over the last few decades, we've gone from a province that had a below-average suicide rate when compared to other provinces to now a province that has an above-average suicide rate. And this now means we're losing one Nova Scotian to suicide about every 72 hours in our province.
That, though, is a snapshot in time, and numbers are numbers, and you can't really refute those. But is there more to the conversation? Is it cause and effect? Can you say that a policy or process that's in place for dealing with people at risk is failing?
I think we can, in that there are a number of impressive success stories within Canada and around the world where government-led initiatives have coordinated action and lowered the suicide rate. I think Quebec provides us with a good example. Around 1998, they had the highest suicide rate in Canada. Their government led a coordinated, well-funded effort to reduce suicide rates. They've reduced suicide rates now consistently by 30%, and very impressively, they've reduced youth rates of suicide by more than 50% in their province. There are examples in England, Scotland, and Finland where similar initiatives have lowered the suicide rate by 10 to 20% for long periods of time as well. It's very possible to prevent suicide, and let me elaborate on why that is.
Mm-hmm. Go ahead.
Suicide is very rarely a single isolated event. Many times, suicide is part of a lengthy, wider process whereby an individual has a mental illness, suicide ideation, there are various suicide attempts, threats, or gestures, and these all represent opportunities for intervention, opportunities to step in and quite literally save the life of a human.
When we, though, talk about, people at risk, the communities that are most at risk, we spoke earlier today about peer groups for students, helping young people perhaps get some of the tools in their toolkit to perhaps deal with friends who may be struggling. When we're talking about the provincial policy, provincial strategy, is it spelled out? Is it clear what the province's goal is, its stated intention, and how it hopes to achieve that?
There are intentions stated, but clearly we're not having a strongly led, well-coordinated provincial suicide prevention initiative. And you're absolutely right to identify that some groups are vulnerable. We know that people with bipolar disorder, people with severe depression, people with schizophrenia, our first responders like paramedics, our military personnel, and members of certain professions like being a fisherman are especially vulnerable to suicide behavior. And yet we don't have targeted interventions for these individuals. It's really a time for action at this point. There's a robust scientific literature on how to prevent suicide, and we're just simply not taking action on that. I think in large part because the political will is missing. There are two things we could do almost immediately that would make an enormous difference in our current suicide rate. One would be to start taking an active approach to reducing common means to suicide. Now, you might think if you take away one way of killing yourself, you simply engage in another way of killing yourself. But that's actually not the case. So things like the bridge barriers that were installed on the McDonald Bridge are a success story here in Nova Scotia, but we need other examples where we're going to take away common means for suicide. A second major thing we could do, once the political will is in place to implement a mental health care system that's already overworked and underfunded, is start to more closely track individuals following a suicide attempt. We know that individuals after a suicide attempt are at ultra-high risk to attempt to end their life again. And so what we need is to start closely following and strongly supporting these individuals, and that has been shown in a number of studies now to make an enormous difference in preventing suicide.
Dr. Simon Sherry is here with us on the broadcast this afternoon, marking World Suicide Prevention Day. And just to, again, put out the words that we had shared earlier, today is World Suicide Prevention Day. If you are in crisis, please reach out for help. The mental health mobile crisis team is out there. It is available. There are phone numbers. What's wrong with that strategy? We're making people aware of, the toll-free phone line, the website, the walk-in. Aren't there perhaps some ways to measure this as being, that we can only do so much for so many?
There's absolutely more that we could do. And let's take phone lines as an example. They are definitely important, but it seems like their primary importance may lie in helping people who are in crisis, and they won't necessarily reduce the suicide rate within our province. So let me be clear. I do believe that those phone lines have value, but research suggests they won't necessarily put a dent in your suicide rate. And that's where we start to run into problems when we're using a suicide prevention strategy that's now decades out of date. And in terms of could we be doing more within our province, there's absolutely no doubt that we could and should be doing more within our province. One thing we could certainly do is provide people with better care to commonly used medications and widely available psychotherapies that have been shown to reduce mental illness and associated suicide behaviors. In other words, if people had greater access to appropriate mental health care, there's no doubt that our suicide rate could go down within our province.
And again, as you say, the information is out of date. What does the new evidence suggest? What does the new information tell us about what we should be doing to help people who are in a vulnerable place who may be at risk of dying by suicide?
Well, another thing we could do within a provincial suicide prevention strategy is look at the relationship Nova Scotians have with alcohol and cannabis. When you reduce the harmful consumption of alcohol and the harmful consumption of cannabis within a population, suicide rates go down. So there are many different avenues we could pursue to reduce the suicide rate in our province, but it involves the coming together of public health, mental health, and political will to reduce the suicide rate. And that's going to require properly funded, evidence-based action.
Evidence-based action looks like what?
It looks like implementing reduced access to means. It looks like providing more medications and more therapies. It looks like attention to responsible media coverage, like the sort of conversation we're having here today. It looks like careful care and support to people following a suicide attempt. It looks like greater responsible use of alcohol and cannabis within our province. It looks like being very thoughtful about how suicide is portrayed within the wider media as well. Those would be a number of things that are directly actionable, that if they involve specific deadlines and specific funds, could be used within a matter of years to turn around our suicide rate. There's evidence in the locations mentioned earlier, like Quebec and Scotland, where within a number of years you can substantively drop a suicide rate in a population.
Dr. Simon Sherry, we are out of time for today, but it is an important day, and we're really glad to have you as part of the conversation on World Suicide Prevention Day. Thank you.
You're welcome. I appreciate you drawing attention to this important issue.
Take care. Bye-bye. Dr. Simon Sherry is a clinical psychologist and talking for revamped suicide prevention strategy for Nova Scotia.